advisor with the Colorado Department of Public Health and Environment. So both of these speakers have robust expertises in their area. So Dan would be able to help us share and learn about Department of Natural Resources and outdoor recreation during this time. And Sarah is able to speak to testing and containment efforts, as well as innovation response. So in order to get started, I will hand it over to Director Gibbs.
Great, thank you so much. And regarding recreation and travel, we think it's very important for folks to first continue to encourage everyone to consider recreating locally as their first option. The further you travel, the greater potential for unplanned emergencies could happen. Second, we want everyone to be serious planners when it comes to recreation. If you do venture out further, check local restrictions of counties and land management agencies of your desired destination. We also want you to consider, pack like you're going to the moon. Don't assume all facilities will be open or available. We want folks to be prepared. So, go to your local gas station before you go to your local grocery store, and don't go to those, locations where you're, traveling to go camping or hiking. Next slide. We want folks to recreate responsibly. So when you get there, please be kind, patient, and courteous to others. We want folks to continue to practice social distancing, avoid risky activities. Please don't become a burden on local emergency services. Early on in March, we saw a pretty high level of search and rescue teams that were really busy dealing with avalanche scenarios. So we don't want folks to, burden emergency services during this time. Also, if you're sick, please stay home. Next slide. So camping, we're glad that both state campgrounds are open, as well as private campgrounds as well. But if you're going to camp, we want to make sure you make a reservation first. So all state parks require reservations in advance. Also, the guidance for private campgrounds will also include that too. Don't expect a site to be available. It's a busy time. Folks are wanting to get out. So we do really encourage folks to make that reservations. Also, it's really important for folks to understand what local fire bans may be in place around the state. It's kind of a patchwork quilt right now. Chaffee County, Teller County, for example, have fire bans. Eagle County does not, for example. So it's really important for folks to really understand and follow those local fire bans and restrictions that may be in place. Next slide, please. It's important to continue when you're outdoors to stay clean. Make sure that the health of others and yourself are a huge priority. Practice good hygiene. Make sure you're continuing to wash your hands. Next slide. It's important to continue to practice social distancing too. We need to continue to keep 6 feet distance between one another, whether you're hiking or trail running or mountain biking. We need to continue that practice moving forward. And then also to wear a mask. As long as it's safe to do so when recreating, you should wear a mask. The CDC recommends that a cloth face gathering should be worn whenever possible in a community setting, especially in situations where you may be near people. If you visit a local trail, it's a good chance you could come within 6 feet of folks passing. I live in Breckenridge and I trail run almost every day. I always make sure I have my handkerchief around my neck just in case I'm passing folks, that I can put that on to make sure I'm respectful of others and also taking care of myself. But cloth face coverings should not be placed on children younger than 2 years old. We want to make sure that obviously these cloth masks that you can breathe obviously through that. Let's go to the next one. And recreational resources. This is a great list of both for parks and wildlife. The DNR has continued to work with our other land managers in the state, our federal partners, the BLM, the U.S. Forest Service, We have put together guidance on our DNR webpage in terms of outdoor recreation that folks should consider. And these are just great resources that folks should use. We also have a Cotrex Trails app that I really encourage you all to take a look at. The website for that is trails.colorado.org, but really a one-stop shop to understand what trails are open, what trails are closed, whether it's county, state, or local trails. We really work with our local partners to make sure that Cotrex app is up to date. And next slide.
Hi, everybody. This is Sarah Thunberg. I just want to say again that we continue to enhance our testing capabilities and capacities across the state, both in our state laboratory and with our private lab partners. We're currently running between 7,000 and 8,000 COVID tests per day. And we have sufficient capacity that we really want to emphasize and would greatly appreciate your help emphasizing that anybody who's feeling flu-like symptoms, anybody who thinks they might have COVID should go and get tested. It's really important that we begin ramping up our testing so that we can then help those people get the treatment they need, stay home safely and healthfully. So making good progress on testing capacity, and really want to encourage Coloradans who are experiencing symptoms to get tested. Next slide. Additionally, as part of our overall COVID containment strategy, testing is a really important part of it, but another very important part of it is once people test positive, helping them stay isolated. And we need to be able to do that through a contact tracing program, disease investigation and contact tracing. And we are so excited to have yesterday announced a really unique and powerful partnership between the state of Colorado and AmeriCorps, Senior Corps, and Vista Corps. Those service organizations who do great work around the country have partnered with Colorado to rapidly enhance our disease investigation, contact tracing, and resource navigation capacity so that for all of the people who do test positive, we are onboarding trained, skilled contact tracers to reach out, make connection with those individuals and help them identify who else might have been exposed and who else should probably be quarantined or stay home and monitor their symptoms very closely. We know that this disease, COVID-19, has sort of unprecedented levels of asymptomatic transmission. So this process of identifying positive cases, asking those folks to isolate at home, and then identifying the individuals who might have also been exposed and asking them to stay quarantined. It's really important, and we're excited about the AmeriCorps partnership that allows us to scale up this capacity. Next slide.
Great. Well, with that, that brings us to the end of our information sharing piece. So we'll go ahead and open it up for questions and answers. So again, if you have a question that you would like to ask, click on the participants button and then click on the little hand icon to raise your hand. I'll let you know when you're on the line. And if you could, please say your name and the outlet that you are with when I call on you, that'd be greatly appreciated. And if there's anything that is maybe outside the scope of what our experts can speak to today, I'll just ask you to send your question along to the Joint Information Center media email box, and someone will follow up with you there. So with that, our first question will be from Taylor Summers. Taylor, you're on the line.
Hello, Taylor Summers for NBC News Radio. Students will return to school in some shape or form in August and September, and I know, Sarah, Colorado has been working hard to expand testing and contact tracing over the last several months. I wonder if you could speak to potential efforts to expand that to test students for COVID-19 when school resumes.
Yeah, so we're working very hard with our education partners across the state of Colorado, as well as with education epidemiology experts at the CDC and within other parties to come up with what the best solution is. And so I don't know what it's going to look like for the fall, but we are deeply enmeshed in that planning and trying to determine as quickly as possible what the right strategy is from a science perspective, from an epidemiology perspective, from a containment strategy perspective, and also one of information and comfort for the families and the educators and the other community members who rely on our education system. So it's a complex problem that we're working really, really hard to solve.
All right, this next question will be from Kim Posey. Kim, you're on the line.
This is Kim Posey at Fox 31, and I'm not sure if there's anyone here who can answer this or not, but we are just wondering when we could get some more information about gyms reopening and then specific information about pools, public pools reopening. And also I have an additional question. There is this national online petition asking law enforcement not to use tear gas in these protests because it can cause coughing. And this petition asked that tear gas not be used during the pandemic. I was wondering if anyone had thoughts on that.
Kim, this is Mariah, the moderator. So regarding the questions about recreation, so gyms and pools, there is the draft guidance on our website still, and they're collecting feedback on that until I think noon today. So there will be more information about that coming. And then the petition piece, I think, could you send that one to the Joint Information Center email box, media_info@state.co.us?
I did that yesterday.
Okay, then I'll follow up and make sure that it came through. Thank you. Next question will be from Sam Brash.
Hey, it's Sam Brash with Colorado Public Radio. Questions on the contact tracing program for Sarah. We've talked to her before about just capacity in terms of contact tracing and in terms of what the state needs. With this increase in the contact tracing staff, will Colorado be able to get in touch with everybody who tests positive for COVID-19? And maybe just talk a little bit too about like how many people test positive now? Are they all getting contacted? And if not, how is the state prioritizing who hears from a contact tracer and who doesn't?
Yeah, absolutely. So in Colorado, local public health agencies have jurisdiction for communicable disease investigation, including for COVID-19. So there is a different risk-based contact tracing sort of level of activity happening in different jurisdictions based upon how many infections they have, how many trained epi and contact tracing workforces they have. Like, it's really unique to each local public health agency. Through this contact tracing program, plus direct funding from CDPHE to local public health agencies to enable and support hiring of additional capacity at the local public health level, plus investments in technology, investments in training, this all together, this sort of holistic program, of which the AmeriCorps program is an important but not sole piece. We will, by the end of the summer, be able to contact trace. Our goal is 95% of our positive cases. And those are the positive cases that get reported to public health. So we will be scaling up to that capacity. And to answer the question of what's currently happening, in different jurisdictions, different local public health agencies have different capacities, but all local public health agencies and CDPHE use a risk-based assessment to prioritize people for contact tracing. And they have a pretty robust mechanism and sort of an algorithm by which they evaluate that. And then a lot of effort is focused on outbreak contact tracing because we know outbreaks can spread very rapidly. We invest a lot of contact tracing resources there, disease investigations, to ensure that those people are fully identified and we can contain those outbreaks, especially for our high risk, high acuity members.
All right, Meg Wingerter, you are on the line. Oh, you're on the line now. Next question.
Meg Wingeter from the Denver Post. I had a question about the level of testing, kind of a two-part. So with the 7,000 to 8,000 tests a day, do you feel like that's sufficient to get a handle on how widely this is truly spreading, since it's focused on people with symptoms? And when you say you want to contact trace 95% of positive cases by the end of the summer, is that assuming that you'll still be testing 7,000 to 8,000 people a day, or is that 95% with an increase in daily testing?
Yes, so lots of those questions. So our goal is to increase testing, moving into respiratory disease or flu season, increase our testing above that 8,000 target into the 10 and perhaps 12,000 target. And rather than just a hard number of tests, we are working to determine the right ratio of positive to negative tests that ensure that we're capturing the full burden of disease at a particular point in time. So that number might fluctuate higher or lower depending on what our disease burden is. But we definitely are increasing our testing capacity to ensure that we are having a full picture. In addition to so that's why we're encouraging people to get tested, because if they don't get tested, we don't know that they're there. They might fill out the symptom tracker, which also people should continue using the symptom tracker on our website. But we also want to make sure that we're accurately identifying who's positive and not, and that's really helpful. And then the other thing we are working with partners on is studies of what the point prevalence in time of disease burden is. And so those are academic studies. For example, a group of CSU, CU, and Anschutz partners, I think, are doing a study to try to assess what just the level of disease is in the community. I think they're starting in Arapahoe County. So that's part of it. And then that 95% contact tracing goal is for no matter what the number of positive tests are. So as we scale up, we will also scale up the number of contact tracers. I think those were all of your questions. If I didn't answer one, please reflect back. Okay, great. Fantastic.
Right. Next on the line, Ray Ellen.
Hey there. So I've got two questions. One, you were just mentioning test positivity as the measure that you'll be looking for to determine if you're doing enough testing. What percent are you aiming for with test positivity in order to, like what's your gauge of a good level of test positivity? And then second, those 7,000 to 8,000 tests that are being done per day, could you give a quick breakdown of like which labs are doing that work?
Yes. So first question, what's the positivity target? That's a question for Dr. Rachel Herlihy. I apologize. I don't know it off the top of my head. And then the breakdown of private lab versus the lab, CDPHE's state lab. Currently, the state lab is processing, I think the 5-day rolling average is 1,400 COVID tests per day. They are targeting to get to 2,000 over the next couple of weeks, and then we'll increase again to 3,000. There is a graphic on the CDPHE website which shows both case positivity and the breakdown of total tests by commercial labs versus a CDPHE lab. So I'd refer you to that for daily counts. We report.
Does that include the individual commercial labs or just breaks public versus commercial? Because I'm kind of hoping to understand, like, is LabCorp doing a bunch? Is Quest? Is it ARUP in Utah? That kind of thing.
Yeah, it just breaks it down by commercial and state lab. I think Mariah and I can take note and see if we have that data and how we can get it to you.
Thank you.
Yeah.
Yes, if you'd like to email the Joint Information Center email, we can also look into that too. And also your first question. Thank you. All right, just a reminder that Director Gibbs is also available to answer questions about outdoor recreation. So next on the line, we have John Mayer.
I have a question for Dan. Can you hear me?
Yes.
Hey, Dan. My question actually may sound a little bit like a personal rant, but I think it would be, some guidance from you would be interesting for everybody using trails. You mentioned that you're a trail runner out almost every day on trails around Breckenridge. We're dealing with a lot of people on single track trails. And I find as a trail runner, of course, I'm not up in Breckenridge, I'm down here in the Front Range for the most part, but in a given 5 or 7 mile run, I'm stepping off the trail 30 or 40 times to make way for mountain bikers. And I'm just wondering if, a long run becomes an interval workout. And I'm just wondering what you're seeing up there and what etiquette you would like to see trail runners, mountain bikers, hikers, demonstrating for each other to be considerate and for everybody to be able to get along.
Yeah, great question, John. First of all, we have been hosting stakeholder meetings, working with our federal partners, the BLM and the U.S. Forest Service, as well as county and city open space departments, to really work to coordinate so that we can all be on the same page. Regarding the density of the trails that you're experiencing, in some situations we are exploring, one-way trails, during this time, so we don't have folks, kind of walking over each other. We have certain designated trails at times that, in my backyard, we have ones that are designed for mountain bikers and other ones that are more appropriate for trail runners or hikers. So, because of COVID-19, I would say, we're seeing a lot more people get outdoors. I would say it's very important for folks' mental and physical health, but we're working to try to, manage, parking, our trail systems, and really coordinate, because let's say, when Rocky Mountain National Park, for example, closed down a month and a half ago, that had huge impacts on Boulder County open space. And so our meetings that we're holding, that we're organizing, really help to coordinate, and we really work together, because a lot of people don't know the difference between, federal, state, county, municipal trails. And so we are looking at all the above for solutions on, better signage, changing the ways that we, have that we have, directional travel, and then also exploring in some situations almost like a system where you can manage how many people can go on certain areas. We're kind of kicking that idea around as well, just because things are getting so busy.
How about etiquette?
Yeah, I think that's important. We have guidance on our DNR webpage on that, and I believe that we may have that on our Cotrex app as well. But that's really important on signage right now, and we're working hard to, get information out there to the public.
All right, great. Next question will be from Kat Kiesling, and if just a reminder to say the outlet that you're with as well.
Hi, my name is Kat Kiesling. I'm with the Dove Creek Press in Dove Creek, Colorado. As Dove Creek is a low density population already in a frontier area, non-tourist, my question is regarding the most recent guidance that was put out and the disallowing of parades. Historically, we have one time of year where the entire community comes together and organically creates a very small parade that goes through town, showing our solidarity with one another. And I'm wondering if the state would be willing to consider variance on this, or is that a hard set rule? And is there a specific reason why those would be disallowed when other events have some allowances, or any way that we can kind of find a balance to have health, to have physical health and mental health for our community members?
Kat, this is Mariah, the moderator again. We do have some information about the variance process on the COVID-19 website, but I think if you could send this question to the Joint Information Center email box, so we could look into that and help answer your question. media_info@state.co.us. Thanks.
Okay, so you don't know if they are just, you don't know if they are, if they will allow it or even entertain it, or if this is a 100% disallowed?
Yeah, I think we would need to look into that. I don't think any of our speakers here have quite the detailed knowledge for that, but we can look into more information for you.
Thank you.
Okay, next question is from Molly Dove.
Hi, this is Molly Dove from Aspen Public Radio. And so I have a question for maybe both of you, but more specifically Sarah, of with tourism coming kind of back to the Western Slope and the Aspen and Glenwood Springs areas, that new contract tracer program, is there going to be any focused on the Western Slope? It seems, I know there was a spot focused on Durango, and so that's my first question. And then kind of a follow-up, is the state closely monitoring any specific area now that businesses are reopening and tourism is starting to increase in places like Aspen and Glenwood Springs?
Sure. So to your first question, all of the contact tracing efforts and skilled epidemiology and disease investigation, technology and training, all of the efforts that we're doing around COVID-19, we're doing in partnership with our local public health agencies. And we are ensuring that we're meeting the needs that they have. And the idea is that we want to empower them to do the work that they need, so provide additional capacity. And so if that's capacity that the local public health agency there decided was really important, we would support that. And then on monitoring, we are monitoring statewide. We are doing our best to understand how the variance processes and the changes in the public health orders affect population movement and what that does to our models. And I know that Dr. Rachel Herlihy and Dr. Samet had a big conversation and a big presentation on how that works and how they do that. And so I think looking back at that, but the answer is yes, we want to be tracking statewide what's happening and making sure that we are, just making sure we're doing our best work.
The next question will be from Libby Smith.
Hi, this is Libby Smith with CBS4 Denver. I was curious if, as we're opening things up, are we accepting tourists from other states yet? Are people free to move through into the state?
Libby, go ahead, Dan.
I was just going to say that the Colorado Tourism Office, they're really the lead agency on that. I know they have more recently been encouraging limited to no out-of-state travel, but that may have changed. But they're the lead agency, and that information is likely on their web page, but I'm not sure exactly.
All right, currently there's no hands raised that I can see, but we did get a question in the chat, and since we have a few more moments, I'll go ahead and ask that. This question is from Sam Brash for Sarah. What percentage of people with positive cases are being tested now? Are the numbers on how far we are from the 95% goal we mentioned?
Yeah, so I don't think we'll ever know what percentage of positive cases are being tested, because until people get tested, we don't know if they're positive. It's sort of a chicken and the egg challenge. I think we will, with a serological study, a statewide serological study, and the Arapahoe County serological study, get a better sense of point prevalence of disease in our broader communities. We'll be able to have a better estimate of that. But at this moment, we don't have that because of that. Then are there numbers on how far we are from the 95% contact tracing goal? I don't have those numbers. Again, varies by local public health agencies. Some are doing 99.9% robust contact tracing, and others are probably more in the 20% category. And it's variable. We're also investing really heavily and rapidly in the data integration and data sharing systems that would allow us to better track and know what that is, given that lots of jurisdictions use Excel spreadsheets or literally paper and pencil because that's how they've always done it. It's difficult to have stats on that. So we're working hard on all of those. Yeah.
I just saw another question come through the chat, and then a hand raised. So a question that came in the chat is from Miles Blumhart, and he asks, when will the commercial rafting season open? And when it opens, what restrictions will be in place?
Yeah,
so, go ahead.
The guidance for outdoor recreation is still being finalized. So we've been working with the associations on that. As you all know, the time to comment will be occurring soon. I guess we'll accept it up through today. But outdoor recreation is rafting is a huge part of our recreation economy in many communities where we've seen $200 million brought into our state's economy. And on the Arkansas River alone, we see about 200,000 trips annually. So we're working to provide the guidance to allow those to open up. We have guidance that will be finalized, but ensuring that there is social distancing, ensuring that when you're in rafts that it's really just one family or two families at maximum be in a raft, and that social distancing occurs from the put in through the takeout really during that whole process.
Thank you. Okay, next question will be from John Meyer.
Hey guys, John Meyer, Denver Post. Dan, could you just talk a little bit about the kind of occupancy or the percent of occupancy that you're seeing at campgrounds? I mean, how often are they selling out? How often are they closed? Or just what kind of numbers are you seeing? What kind of capacity are you seeing? How difficult has it become to get campground reservations?
For our state parks, let me just share some numbers with you. Put aside camping, but for the month of March last year, for our Northeast region, we saw about 300,000 visitors. For March this year, we saw about 512,000. So, over 200,000 people, increase just our state parks. Now, when we opened up our state parks originally for the month of May, we were at 50% capacity. So for those state parks that, folks had reservations that were already filled, we had to let folks know that, we gave refund checks to some of those folks that, we just did not want to have maximum capacity starting out. And as we continue to hire, we hire about 1,500 seasonals, both full-time and part-time. As we ramp that up, we will continue to kind of open up the doors for more camping opportunities. We are not at 100% capacity, right now, but it's been busy. Pueblo Lake State Park Memorial Day weekend, we were not allowing more people to come in. We were waiting until folks would leave before folks were allowed in. We've also, closed our larger gathering locations. For example, the beaches are closed. The large-scale pavilions are closed to really discourage people from, mass gathering. But we're really proud of the fact, and thank you to the governor's leadership, we're one of the few states that we've been able to keep our state parks open during this whole COVID-19 challenge. And we're really happy to have our state parks camping opportunities open right now. And I'm really excited too to have our private campgrounds open. And the U.S. Forest Service is a very important partner as well. They have set the guidance for the White River National, or for the Region 2, which includes all of Colorado, to really leave it up to local forests to decide the time frame when they want to open up camping. So for example, I'm in the White River National Forest in Summit County, and the campgrounds just aren't open yet because there's still, snow on the ground in some locations. But other regions around the state, do have, openings. But it's going to be a busy summer, and from my experience traveling around the state and visiting some of our state parks, I feel like folks are following the rules with proper social distancing, wearing masks, and just really having a great time with their families.
All right, next question, Ray Ellen.
Hi, Ray Ellen Bichelle with the Mountain West News Bureau. Sarah, you've mentioned a few times Arapahoe County seroprevalence survey. Can you go into what that is and what the timeline is for that project?
I actually don't know. I know it's happening. I know it's launching. The target are, I believe, seroprevalence of COVID among first responders. It is not actually a study that CDPHE or the state of Colorado is involved with. We're just watching with bated breath, excited to see what's happening. So I would direct you to Arapahoe County to get more information.
All right, and we have maybe just a couple of more minutes. So John Mayer, I see you have another question, so you're on the line.
Yeah, just a quick follow-up to make sure that I understand that number. Dan, you said that the number, I believe it was March, 300,000 last year versus 512,000 this year. You did say that was March, right? And does that reflect any time that the parks were closed?
No, the parks never close, and those are just numbers for March. And we, state parks camping, was closed for a duration, but our state parks were never closed. So, but yeah, that's for March last year to this year, 300,000 versus 512, and that is just for the Northeast region. I can get you numbers statewide. Statewide, it's well over 500,000 increase.
Wow.
All right, Kim Posey, I have you on the line.
Yeah, I just wanted to know if somebody could give from here, what else should we be expecting this week? What is next in this safer at home time period? I know you'll get the input through today, and then what is the next step?
Sure, so this is Mariah, the moderator. I believe the next step is that after the guidance, we get feedback on the guidance will go into effect. I do want to acknowledge that we got one more question in the chat from Miles Lumpart about rafting. Do you see commercial rafting season opening by this weekend?
You know, I know that the guidance still needs to be approved, and they have until, you know, today. And assuming all goes well, there's a local government component, so very similar to ski resorts, where previously the governor announced that, you know, ski resorts are able to open as long as local governments approve of that. So there is a local government connection there too, to make sure that folks are on board with that.
I got one more question into the chat, and then that brings us pretty much up to the end of our time. So Ray Ellen was wondering, what % of known COVID cases are being contacted by contact tracers?
Yeah, absolutely. So as I said earlier, it depends, the number and percentage varies based upon local public health agency capacity, case counts. And so in some places it's nearly 100%, while in others it's as low as 25%. Varies greatly.
And then I'll just acknowledge too that Heather Coyne asked in the chat if the safer at home order is already in effect. Nothing in the guidance will differ from this order question. So a new public health order went out, was published last night, and that's posted on the website. So you could review that, and then also the guidance that goes along with that, and the draft guidance as well. And the COVID-19 website is really the best place to stay up to date regarding all of those changes. And that brings us right up to the end of our time today. So we thank you for joining us. Again, we had Dan Gibbs, Executive Director of the Colorado Department of Natural Resources, and Sarah Thunberg, COVID Innovation Response Team Lead and Senior COVID-19 Advisor for the Colorado Department of Public Health and Environment. We thank you so much for joining us, and I hope you have a great afternoon. Thank you.